Hip replacement is designed to remove the worn-out surfaces within the hip joint. Hip joint is a ball and socket joint, and with wear and tear, for many reasons, for example, osteoarthritis, the articular cartilage covering the ball part and the socket part get worn out. This can create pain and disability with stiffness and difficulty in doing daily activities. Hip replacement is designed to remove that worn out surface with having a new cup, which is metal, and new ball, which is again metal inserted into the thigh bone with a ball articulating into that, which can be either metal or ceramic. The articular part, which is the acetabular part, the cup part, has also different types of articulating surfaces. For example, highly crossed polyethylene, which is a plastic, or it could be ceramic. And these are the most commonly used in hip replacement. There are many reasons why they need hip replacement. The most commonly used reason, or the most common reason to do hip replacement, is osteoarthritis or inflammatory arthritis, which causes wear and tear within the joint. However, this also can be used in case of fractures when people have a neck or femur fracture where the blood supply gets cut off to the ball part of the hip joint, where we require to do a hip replacement to improve that. But there are other reasons, not only these. But it is a great operation designed to relieve pain and improve function. Thank you. So hip replacement surgery can be performed in many ways, and this includes conventional way, robotically assisted way, and there are different approaches as well can be used to achieve this operation. My current way of performing hip replacement is to do a robotically assisted procedure where the patient, after getting the anesthetic, will be lying on their sides, and then the scar will be at the back of the buttock. There will be another small incision on top of the pelvic bone to attach some pins to attach to them some arrays to communicate with the robot. Then after that, I use the posterior approach, which also I spare some of the muscles to prevent cutting through all tendons, and this will allow me to access the hip in a great way where I look at all the joints without any obliteration of the vision, and this will help me to put the implant in the perfect position. On top of that, I use the robotic assisted arm where I will put the implant with a precision based on the three-dimensional picture of the bone based on a CT scan, which will be done prior to the operation. It is a successful operation, carries some risks and benefits, and patients usually expect that they will walk immediately after the operation, sometimes using crutches for a few days until they get the confidence back. During their stay in the hospital, they will see the physiotherapist, will take them through all the exercises and take them through the stairs to make sure they are safe to go up and down the stairs and they can go home safely. Patients should expect that they will have pain in the first 2 weeks up to 6 weeks, and the recovery should be within 6 weeks to 3 months to go back to normal. Thank you very much. The potential benefit of having hip replacement is massive. So first of all, before we talk about the benefit, we talk about why patients come to a surgeon to have hip replacement. With hip pathology, whether it's a fracture or it's osteoarthritis, although they are different category, but they all meet in one thing, which is inability to walk or walk without pain. And the other thing difficulty in basically doing daily activities. For example, walking or getting into a car or out of the car, doing the shoelaces, putting on the socks or taking off the socks, or even putting shoes. This is all difficult when you can't actually move your hip. Therefore, the potential benefit of hip replacement is to alleviate the pain and the stiffness to allow people to do all these activities like normal. It is really a successful operation, gives the patient the movement back and the freedom of movement back and relieve pain so they can conduct their daily activities without any problem. They can get back to walking or even running and doing their normal daily tasks, for example, gardening or other activities, and even sports. The recovery time after hip surgery, after the operation, there will be scar and incision. There will be some pain, and in the first 2 weeks will be probably more painful because this is a surgical pain. However, majority of patients, they say this is completely different pain than the pain we had before, and it's a better pain. Pain is possible after the operation. We will give enough pain relief medications to help in alleviating the suffering in the first couple of weeks. Having said that, the majority of the patient, actually, they have minimal pain. We give a crutches to walk with, and this is for the first week or two until the patient get the confidence back. After 2 weeks, they will come and see me. We will look at the wound, make sure everything is healed, and then at this point, they can start having bath or shower without any cover around the wound, and they start to walk more and more. I expect patients to get back to a good level of function within 6 weeks. However, by 3 months, I expect them to go back to normal. As I mentioned before, during their stay in the hospital, we will make sure that they meet our physiotherapy team to go through everything related to their activities and exercises, but also afterwards, they will have their physiotherapy either at their homes or outside. They go to specific gyms where they do all kinds of activities to get the movement back and to get the function back of the hip. I expect the patient to start to drive after 6 weeks and to go back to normal activities within 3 months.